Fear of losing our brains, of losing our minds. It's a terrifying idea. And key to this concept is the conversation around dementia. This by itself is a word that strikes fear into so many people's hearts. The idea of losing our cognitive abilities, of forgetting our loved ones, of losing our cherished memories, it is scary stuff. And dementia isn't just a health issue that impacts the person experiencing dementia. This is something with massive ripple effects. I've personally lost two grandfathers to Alzheimer's disease, and I can tell you that it influences family, it influences communities. Again, the ripple effects are so significant. Dementia affects not just those who suffer from it, but all those around the people who are suffering from dementia. Despite the prevalence of dementia and despite these massive negative effects on the quality of our lives, so many people continue to believe that there is nothing that can be done until we get a diagnosis of dementia. This is not just disheartening, it is also incredibly misleading because research tells us that so many cases of dementia, and in particular Alzheimer's disease, are preventable with the steps that we can take each day. In this video, we're going to explore the different types of dementia, the impact that dementia has in our lives, on our society, potential causes of dementia, why we ignore dementia until it's too late, and most importantly, the steps that you should be taking each day to help prevent your chances of getting dementia. I'm Dr. Austin Perlmutter, and if you love practical brain science, please be sure to subscribe to my channel. Also, quick disclaimer, this is for educational purposes only, and you should talk to your healthcare practitioner before making any major changes to your healthcare protocols. So let's start with a little bit of background. How big of a deal is dementia? Dementia, first of all, is not a single disease, even though it's often described in that way, but an umbrella term that encompasses various conditions, all characterized by a drop-off in cognitive function. If you live to age 85, you have a 1 in 3 chance of developing dementia. And of the types of dementia, Alzheimer's is the most likely. Alzheimer's disease or Alzheimer's dementia encompasses around 70% of all cases of dementia and affects over 55 million people around the world. Two-thirds of cases of Alzheimer's disease are women. Other forms of dementia include vascular dementia, Lewy body dementia, and frontotemporal dementia. There are a number of other cases of dementia, including alcohol-related dementia, but these are the most common. And each type of dementia has distinct characteristics. The key takeaway, though, is that they all relate to this dramatic decline in brain function. So let's go through a couple of statistics. In the United States alone, nearly 7 million people are living with Alzheimer's disease. And this is a number that is rapidly increasing in terms of total number of people with Alzheimer's disease. Globally, there are 10 million new cases of dementia each year. And it seems like this situation has worsened in the context of what's happened since the COVID-19 pandemic. When we look at certain disease numbers in the last 100 years, we see that infectious diseases, people dying from infections, have dramatically decreased. But the people who have died of Alzheimer's disease have gone up almost 150% in the last 20 years. So we seem to be losing the battle against dementia, and we have to do better, and we can do better. Let's talk about what causes dementia. I do want to say that there are a number of hypotheses as to what is driving dementia, and the best explanation that I've seen to date is that it is not one specific thing. Specifically, as we look at Alzheimer's disease, we see that there are certain risk factors that convey a higher risk for developing disease. So in the context of Alzheimer's disease, the ApoE4 gene does translate into a higher risk of developing Alzheimer's, whether we are heterozygous, having one copy of that gene, or homozygous, having two copies of that gene, can increase our risk for developing Alzheimer's between 3 and 15-fold. But genetics is only part of the story, and this is a absolutely essential take-home point. The majority of the risk for dementia seems to be due to things beyond genetics, meaning that the majority of the risk are risk factors that we can act on. Most of what drives our risk for developing dementia is within our control. The potential causes of dementia, again, are varied. There are many different potential variables. A couple of the variables that have been best described include things like chronic inflammation, metabolic dysfunction, and exposure to various environmental toxins. We also know that sleep apnea, GI issues, specifically things like changes in the gut microbiome, a more permeable gut membrane, even changes in the oral microbiome, various infections, herpes simplex, tip-borne illnesses, these are all linked to an increased risk of dementia. When it comes to environmental risk factors, we also understand that air pollution turns out to be a major risk factor in terms of developing dementia, especially Alzheimer's dementia. In addition, age is the most studied risk factor in terms of correlation with developing dementia. As I have said, if you look at people who are 85 years old or older, they have a 1 in 3 or a 33% chance of developing dementia. So as we look at the different risk factors, there does seem to be a significant component of what age does. Now, is it because we're getting older, or is it because we are accumulating exposure to all these other environmental and other lifestyle variables? It is far more likely to be the accumulation of these variables, in addition to some things we'll talk about in terms of what happens to our bodies as we age. With all of this in mind, in terms of all of these different things around us that can increase our risk for dementia, it is so important for us to shift the conversation in terms of the most important risk factors for dementia from a purely genetic predisposition to a conversation that incorporates the significance of lifestyle choices in determining what happens to our brains as we age. As we look at, for example, Alzheimer's disease in a little bit more detail, we see that despite the fact that the ApoE4 gene variant gets so much play, and despite the fact that amyloid plaque, this is a plaque that builds up within the brain of people with Alzheimer's, as well as certain healthy people, despite the fact that these two things get so much of the conversation around them, it is important to understand that there is far more at play than these two variables. And so when we think about these conditions, when we think about dementia, I truly believe the research is indicating that while variables like amyloid and ApoE4 are an important part of the conversation, we have to expand the conversation and we have to look upstream. So while beta amyloid or amyloid is important in certain ways of looking at Alzheimer's disease, we also need to look at what maybe is driving beta amyloid, what is coming upstream from beta amyloid, which then becomes a downstream process. Another question that is absolutely vital for us to understand is this question of why do we ignore dementia until diagnosis? This is so problematic. Like so many brain health conditions, I should say mental health and cognitive health conditions, we generally don't worry about dementia until it is unavoidable, until a spouse, a friend, a sibling, or a child brings somebody in and says, hey, I am worried about dad's memory, or I'm worried about my husband's memory or my wife's memory. This is so late in the game because just like cardiovascular disease, dementia is thought to be a reflection of changes that happen in our brains over decades. And key to this conversation is the understanding that our best chance of doing something about dementia is decades before we actually develop symptoms. Now, I think there's a component of this which relates to denial. We don't want to acknowledge that there may be issues with our brains, or maybe issues with the brains of our partners, with our friends, with our family. But the reality is, the longer we wait, the harder it is to start making the changes that can prevent various aspects of cognitive decline. And in the clinical setting, it is so often the case that when the symptoms are significant enough to where somebody shows up in the clinic and says, I'm concerned I have a problem, that the disease may actually be far more advanced. So a person is far more likely to have mild cognitive impairment or MCI, or even more advanced dementia. And this complicates management, and it certainly complicates changing lifestyle habits to decrease symptomatology and to slow the rate of decline. Our tendency as a society in general, and this expands far beyond just dementia in the United States and really around the world, is to ignore our symptoms until they are so bad that we can't avoid them anymore. And the most effective strategies for Alzheimer's and other forms of dementia requires us to acknowledge that these are major concerns, that there are things that we really need to do this moment, decades before we have brain issues, to prevent our risk for developing dementia. Now, importantly, The nice thing here is it's not just about preventing dementia. The same things that help to prevent our development of dementia and may even improve certain aspects of dementia are the things that enhance our general cognition and can even help to support things like mood. We're going to talk about some of those very specific lifestyle modifications, but the point being, the earlier you can get on board with the idea that the best way to prevent dementia is to work on it decades before you ever have a symptom, the better we're going to be in terms of actually decreasing this global burden of dementia, which is so problematic. So, all I'm saying here is that if you're interested in this topic, and if you have friends or family members who are interested in this topic of dementia, the best time to start working on preventing dementia or even treating dementia is right now, before it's decades later and things have become far more taken hold, far more concrete in terms of how our brains have been rewired and reprogrammed towards dementia. Another consideration around dementia is that our modern day lifestyles really predispose us to becoming distracted. And unfortunately, our modern lifestyles, which are packed with unhealthy diet, unhealthy media consumption, poor sleep, not enough exercise, generally high levels of stress, are all things that simultaneously keep us fixated on, keep us craving these unhealthy habits, and increase our risk of cognitive decline. So we become stuck in this scenario where we're perpetually chasing things that are trying to make us feel better, but actually in the long run make us feel worse and decrease our overall quality of brain health. So with this in mind, just as a quick recap, there are multiple types of dementia. These are things that influence people around the world at very large scale. And there are powerful things that we can do to decrease our risk of developing dementia, but we have kind of become a part of a society in which most people ignore dementia until it's too late to do the most meaningful stuff. And we have created a society where we're actively distracting ourselves from being able to focus on the most important things that are necessary to help prevent dementia. So, what can you do? What can we do right now to decrease our risk for developing dementia? The best studied interventions are going to be simple lifestyle modification. This is so important. You'll probably see ads on TV, you'll probably see ads on social media, you'll even see blogs about how some breakthrough new ingredient or supplement is going to reverse dementia, is going to prevent dementia. The best studied interventions are going to be lifestyle modifications. These are not sensationalized quick fix schemes. These are longitudinally applied interventions in terms of eating a real food diet, in terms of getting good sleep. So let's go through some of the best studied interventions that can help you to prevent development of dementia. And by the way, improve your brain health right now. Starting with number one, diet. If we think about diet, diet is how we program our brain building blocks and change the way that our brains function through physical building blocks that come through our food, are absorbed by the GI tract, and then get conveyed throughout the body and to the brain. The best studied diet when it comes to prevention of dementia is a diet similar to a Mediterranean pattern diet or the MIND diet. Both of these are variants on a theme. They're just kind of saying eat a lot of minimally processed foods. They do emphasize consumption of a variety of whole, minimally processed foods, including fruits, vegetables, nuts, seeds, healthy fats like olive oil. They also tend to prioritize things like omega-3 fats, which can be found in fatty fish. They tend to deprioritize added sugar, too much red meat, unhealthy oils, and alcohol. So there's a lot that can be said. And certainly, if you're somebody who pays attention to diet, there's probably something I said there that you disagree with in some way, shape, or form. But the main point being, and I think where all of us can agree that there is a ton of data, if your goal is to enhance your brain health, protect yourself against dementia, you should be avoiding the standard American diet, which is rich in ultra processed foods, anything that has added sugar, anything that contains ingredients that you don't understand or haven't heard about before. Generally speaking, ditch those and instead migrate to the periphery of your grocery store and buy real single ingredient foods. And you're going to be giving your brain a major step up in terms of the prevention of dementia. The next intervention, and maybe the best studied intervention in terms of decreasing risk for developing dementia, is exercise. We know that when we move our bodies, and I don't mean just aerobic exercise, but even lifting weights, when we put pressure on our muscles, when we exercise our bodies, this has a dramatic, immediate, and long-term positive effect on our brain health. So data would suggest that people who exercise regularly may have as much as a 50% decreased risk for developing dementia. This is so important. Exercise acts on pathways like inflammation, metabolism, and it has so much to do with programming our brains for health. As long as we're talking about mild to moderate exercise, the best studied intervention is really moderate exercise. There is something to say as far as extreme exercise and potentially being a liability. I don't think that that is a real risk for most people because most people barely move their bodies in the course of a day. So the intervention here is really straightforward. It is simply moving your body, walking, swimming, yoga even, but if you really want to be specific about it, shooting for around 150 minutes of moderate intensity exercise each week, 2 to 3 bouts of resistance training with weights, basically loading your muscle groups because we know that when we have strong muscles, it can help to program a strong mind, a strong brain. Simply moving your body seems to be the key. The third major step in terms of preventing dementia is going to be prioritizing sleep. Sleep is essential for good brain function. Study after study finds that people with poor sleep, disrupted sleep, are at higher risk of brain issues, including dementia. What can you do to improve the quality of your sleep? Well, certainly it is the basics. So decreasing the temperature in your bedroom, decreasing the noise in your bedroom, decreasing the light exposure in your bedroom, not consuming a ton of stressful content right before bed. But if you are struggling with good sleep, I highly recommend talking to a health practitioner and considering an evaluation for conditions like sleep apnea, restless leg syndrome. These can dramatically decrease the quality of the sleep that you receive, but when treated, can dramatically improve your quality of sleep, and in doing so is a powerful step towards decreasing risk for dementia. Step number 4 is going to be looking at stress reduction. Stress is a cornerstone of our modern lives, and you can't get rid of stress completely. However, chronic and unmanaged stress is a major risk factor in the development of dementia. How do you work on chronic stress? Some of the basics are mindfulness, even exercise, nature exposure. But again, if you're struggling with significant stress, this is a great opportunity to seek professional help. Number 5 is going to be to prioritize social connections. Some of the best research we have specific to happiness and quality of life shows that when people are socially connected, they do better. Now, with this said, people with better social connections actually have a lower risk for developing dementia. It's easier said than done. I know that. But simple steps like calling a friend or getting in touch with a loved one can be amazing ways to rekindle social connection and protect your brain. And number 6, the last one that I want to mention here in terms of how to help prevent dementia, is to avoid harmful substances in your environment. Now, I know the word toxin gets thrown around a lot. It can have different meanings depending on who you look at and who you listen to. But in this case, we're talking about substances in our environment that are known brain toxins. That includes decreasing or really not smoking. I'll be clear on this. There is no amount of smoking that is of any benefit to us. And if you smoke, it is absolutely one of the best things you can do for your health to work on quitting smoking completely. Again, highly recommend working with a healthcare practitioner to help you make this happen. Statistically, people who work with healthcare practitioners are far more likely to stop smoking and to continue that cessation over time. Next up, minimizing excessive alcohol consumption. So alcohol in large quantities is absolutely a brain toxin. Here's a scenario where there's been kind of mixed messaging around what it means related to the brain. There's some data finding that mild to moderate alcohol consumption is correlated with lower rates of dementia. But from a mechanistic perspective, alcohol is toxic to our brains. If you're struggling with alcohol, again, seek additional care, seek medical care. This can be obviously a very potent addiction, and seeking help is a great opportunity to decrease your risk factors for dementia. Lastly, I'll say that air pollution has become one of the most important recognized risk factors for developing dementia. Air pollution is all around us, and it's a myth to think that most air pollution to worry about is outside because the majority of our time we are inside of our homes, inside of our cars. It's actually 95% 90 to 95% of the time that we are indoors. What can you do to decrease your risk of exposure to air pollution? Well, one is pay attention when you're cooking. Use a hood or other ventilation. Cooking is the top source of indoor air pollution. Don't use candles, scented candles, incense in your home if it is smoking. If it is smoking in your home, decrease your exposure to that smoke, or maybe nix the smoking thing altogether. And the last thing I'll say here in terms of exposure to harmful things in our environment, it's not exactly a substance or a toxin, but head trauma is a risk factor for development of dementia. So if you are going to be on a bike, if you're going to be in a car, use a seatbelt in a car, use a helmet on a bike, and really think about, am I at risk for a traumatic brain injury? And if so, what can I do to decrease that risk? So, with all of this in mind, these are some of the things that you can and really should be doing each day to help decrease your risk for developing dementia. Many people want to know, where is the research in terms of new interventions for people with dementia? So, certainly we've seen a lot of new drugs that have been targeting amyloid. The research has been a little bit mixed. So while there have been some improvements in terms of a slower rate of cognitive decline in people with dementia who use some of these drugs, there are side effects like brain swelling and even brain bleeding in these people who are using these drugs compared to people who are not using these drugs. I'm not opposed to medication. I'm certainly not opposed to pharmaceuticals when used effectively. But what we do know is that right now, and we are right now in 2024, towards the end of the year, there are no pharmaceuticals that are as powerful, and certainly no pharmaceuticals with a low side effect profile similar to what a person gets from decades of healthy lifestyle. And the best bet that you have right now to work on dementia is prevention. So I'm highly interested in learning more about what we will find in terms of pharmaceuticals and other therapeutics for dementia. But as it stands right now, if your goal is not to get dementia, the best studied interventions are going to be the things that I just described. So that's a lot of content on the subject of dementia. I hope you're coming away with this with the understanding of how much is within your hands as it relates to decreasing your risk of developing dementia. If you're interested to learn more about this topic, you can see that I have lots of other videos and blogs on this subject on my website and on YouTube, as well as other podcasts. So I invite you to check that out. And if you haven't already subscribed to my channel, please check it out, see what you think, and I'd love to hear more from you later. Thanks for watching. I'm Dr. Austin Perlmutter, and I'll talk to you again soon.